just be going over our agenda briefly today. So we're all here to share the updates and of the work that's being done in India by Seva Canada. So one of the things we'll go over is what's been done so far in terms of COVID relief and the work in progress that's going on. And another is the problem and issues on the ground and the problems that are expected in the future, and what the work will look like going forward in terms of COVID relief. And at the end, we will also take questions from anybody who has any questions about all the work that's being done. So please do keep your questions towards the end when we have the session. And we also have some testimonials from our partners who are helping with all the donation efforts. So just some housekeeping rules. If you can, please do leave your videos on and keep yourself muted unless it's required otherwise. But for now, just keep your videos on and keep yourself muted. So now I will introduce the president of Seva Canada, Ashok Gautam ji, who will give us our welcome address.
Namaste, everybody. My name is Ashok Gautam, and I've been with Seva Canada for 22 years. And we all know for the last few months, we've been in a very, very testing times, not only in India, but all around the globe. Our family in India and Nepal have lost hundreds and thousands of members, and survivors are going through a very, very difficult and unprecedented hardship. However, in these dark times, there was a ray of hope. When our appeal for help went out, your kindness and generosity was overwhelming. Our community came out united to ease suffering of our brothers and sisters in India and Nepal. You entrusted us with your hard-earned money. So far, we have raised about $716, and this would not have been possible without number of thousands of donors from coast to coast, our partners, charitable organizations, individuals, and corporations, and our Seva everywhere in Canada, all around, and in India. And especially my personal thanks to Vinodji and Sanjayji, who worked so tirelessly to get this information out and keep you updated. Now, you have given us the money. It's contingent upon us now to do what you expect us to do. And Vinodji will later explain what we have done so far and what our goals are, so that in future we are properly prepared for disasters like this. Our aim at Seva is to alleviate poverty, help ease sufferings during natural disasters, and provide facilities for less fortunate children of our community to educate themselves and make them proper global citizens. And we want them to become contributing members of the community. From time to time, we will be asking you for your help to achieve this goal. Please have faith in Seva and join us to achieve this mission. And once again, I thank you so much for your kindness and your generosity, and may God bless you all. Thank you very much, and namaste.
Thank you, Ashok ji, for your insightful words. Now I'll pass it on to Vinod ji, who will do the presentation on what's actually going on in India right now.
Namaste, everyone, and welcome to this event this evening. And it's an honor to be amongst all of you, many of you I've talked to, interacted with. So it gives me real pleasure, and in many cases, to put a face to the name. Now, before I start my presentation of how where we have got so far, the now and the beyond, I would like to ask you a question. Apart from the virulence of this COVID-19, the Delta variant that hit India 2 months ago, what do you think was the next most challenging factor, apart from the virulence of this virus? Think about it. And this is one issue that every not-for-profit organization operating in India had to go through. The biggest challenge for them, next to the virulence of the virus, was getting people to work on the ground, volunteers. nobody wanted to put their life on the line and do that. And Seva in India, we had less of a problem. We had people, thousands of volunteers, young, 20s, 30s, some older, who went out onto the roads doing what we wanted to do, what we wanted them to do. And I'll just take a moment to narrate an experience. So I was on a call with our Seva Bharati folks in Madhya Pradesh. We were on a conference call and talking about the planning. And I was talking about people, our Swayam Sevaks or Sevaks on the ground, and I asked them, are they, what protection have they taken? Are they vaccinated? I heard a pin drop silence. None of them were vaccinated. And here they were. And they had not thought about it, about vaccinating themselves. This is how selfless they are. And tragically, we lost a few too. So before I start my presentation, I really give my pranams and bow down to their selflessness, which all the volunteers from all the charitable organizations, how they served. It was tough. It was like going into the battlefield, just that you didn't have a gun and you couldn't see who the enemy was. Just made it much more tougher. So my huge shout out to them, pranams to them. We lost some of them, and they just inspire us much more to do more. So I will share my screen now, and we'll go on to the presentations, and I'll talk to that, talk to where we are. So again, welcome all of you. And after I thank the volunteers on the ground, I'd like to thank each one of you. And with many of you, I've been talking on a daily basis. You inspired me to do more, and we've all done this together. We've done this together. So a huge shout out to all of you who have donated, going out of the comfort zone. And we'll hear from a few of them who have really gone out of the comfort zone and worked with us in the past a couple of months. So again, thank you for helping us breathe. And this is a picture from Karnataka, where we had deployed some concentrators, and you'll hear from the Karnataka, our point man in Karnataka, talk about it later on in the evening. So what have we done so far? So with the money that we have raised so far, like Ashokji alluded to, we have raised $716,000 so far. It's trickling in, a little more is trickling in, but that's what we have raised. With that money, we've divided it into the immediate relief and the long-term relief. And what you're seeing on the screen right now is the short-term relief that we have done. So our intent was to go in and provide oxygen, because that was the most precious commodity in India 2 months ago. So we did that. We were able to move quickly, and we were very fortunate to be able to work with some people who had good logistics, who had good contacts in Hong Kong, Singapore, and China. And we were able to source these concentrators in a matter of 2 weeks once we placed the order. And I've heard, horrible stories of people not having concentrators even now, or them getting concentrators now when it's at the tail end. So 230 concentrators, thermometers, oximeters, and accessories in 10 states. We started off with Gujarat and Karnataka, but then as the needs kept coming in, we expanded our scope of activities. So this is where 50% of the money went towards, and we paid the vendors directly. So there was no money transferred to India. In addition to providing oxygen, as you can see, our volunteers did things like going around to the bastis and the communities, doing oxygen temperature checks, providing food relief because of the lockdown, and people in isolation needed food. PPE kits needed to be given out, and the most onerous task of performing cremations. And as you can see, one of our volunteers doesn't even have a PPE kit. It's just do it kind of thing, right? So they were doing these the passage or the last rites for many of the victims too. So, and also our partners on the ground did set up COVID care centers, because the hospitals were overflowing. There were nowhere to go, and people needed a place to isolate. People needed a place to get oxygen. So our COVID care centers did that, and at the peak of it, it really helped take the overflow in. Now, so all of this, but what impact has all of this had on the ground? And a picture is worth 1,000 words. So I'll just leave those pictures with you. And these are pictures of the concentrators that you have donated in use in the field. These are pictures from Kerala, Tamil Nadu, from far away Manipur as well. And if you look at the spread, we had down south Manipur, Kerala and Tamil Nadu. We had done Punjab in the east, in the west, Gujarat, and the far east, Manipur. So we had a big geographical spread. And this is what saving lives means, giving oxygen when it's most needed. And we'll hear from some of the representatives on the ground a little later in the program. So this is the impact in pictures. These are our volunteers serving food at the Gujarat, at the Ahmedabad Civil Hospital. We have tons of pictures. And the other one is from Manipur. Again, our volunteers there. This is the Bhopal, the center in Bhopal, the COVID care center. And we also used auto rickshaws. So in many cases, we had the COVID care centers with oxygen. And in many other places, we had oxy banks, and people would take these concentrators around to homes and provide it to people in home so they could get oxygen in home. And that's become more popular. And as the tail of the second wave is on right now, we're finding wherever we need concentrators, it's mostly in homes, and where we are able to give them residual. And some people, even after they test negative, in some cases, they do need some oxygen. So that's where our concentrators are being used now. The use of concentrators right now is low. It's low, and it's mostly in homes, but we're preparing for the next wave, and it's coming. So that's where our volunteers are focusing, our partners on the ground are focusing on. This is one of our very inspiring group from Montreal, Jumle Dance, and they wanted to work, or they have picked up an area in southern Gujarat, in the tribal districts of southern Gujarat. And this is a picture from there. There are tons of pictures, and that you can go to. If I click on my screen right now, it'll take you to a whole bunch of pictures, and you can see all of that on our website. So there are tons of hundreds of pictures there that you can, and it just tells stories. And these are our pictures from our partners. And you must understand, getting pictures during these times is not the easiest thing, and it's not top priority. So, but still, even then, they have managed to get us what they've been doing on the ground. Now, back to our presentation. Now, that was the oxygen relief. The next part of our work is providing life-saving equipment to hospitals. Now, this was very tragic. What happened was tragic. It kind of lay bare the chinks or the weakness of the health system in India. And this is a perfect opportunity for us to work on it. This is an opportunity that we can take and do the best we can to improve the medical infrastructure in India. And as we went through it, we kind of heard stories of people not being able to make it to hospital because of the lack of ambulances. And you'll hear that from General Singh from Manipur. You'll hear it from many others. They had to be taken on carts, or they just couldn't make it in the tribal areas, in the rural areas. So we provided 2 ambulances, one in Madhya Pradesh, one in Manipur. We've done that. We are also working with hospitals in identifying expansion needs, ward expansions, ICU beds, dialysis machines, and mobile X-ray machines and equipment that they need to expand their COVID wards, so that when this happens again, they can, they have the infrastructure in place to do it. And in Maharashtra, we learned that the COVID ward had to have everything that was in the normal ward. Because if somebody had a dialysis issue, a COVID patient needed dialysis, he couldn't be taken into the other ward. So the COVID ward had to have a dialysis machine as well, right? So not just oxygen. So there was a lot of learning for us through this process. So this is what we are working on now. And we are working with General Singh in Manipur as well in identifying needs. So we go through a diligent process in trying to find out the requirements and then addressing them. And I have an equipment list here, which if you're, this is what we go through. So here's our equipment list. Some we have done and some we are still working on. So this is what it is. These are Google Sheets. I'm just opening up the Google Sheets that we work out of daily on. So now moving forward, what are we going to do in the future? Oxygen, 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 right? That was the the buzzword in India 2 months ago. Since 2 months ago, everyone in India has become an oxygen concentrator expert, by the way. So everyone knows what an oxygen concentrator is and all that. So we are building two. So from the money that you've given us, out of the $716,000 for the long-term funding, we are proposing to do, or we have identified these two locations, one in Gujarat, one in Bengaluru, in Karnataka, where we will help put 250 LPM oxygen plants. So that's something. It costs $100,000, 50,000 a pop. So it's $100,000 right there for 2 oxygen plants. But the thing is that we will have infrastructure ready, and these are hospitals that are either charitable hospitals or low budget hospitals. So we kind of avoid, and these are in rural areas. We've kind of kept that due diligence as well. Now, between oxygen and the social and the human impacts and the economic impacts, so this is something that we discussed for a long time. Initially, it was oxygen, but we have realized that this pandemic has taken a toll on families, orphans who have lost both, or children who have lost both their parents, the sole breadwinner gone, and migrant workers returning back from the village, from the cities, who are unemployed now, and young people can't find jobs, and just the economic impacts of the whole lockdown. So this is going to be much more than what we anticipated. So yes, oxygen was required, and oxygen needs to be there, infrastructure needs to go in there, but the human suffering, especially among the underprivileged, the marginalized communities, it's taken a much bigger toll. It will take a much bigger toll, or is taking a much bigger toll on them. Fortunately, the government of India and many the governments in the provinces have come out with allowances for children who have lost both their parents. But in some cases, what if one parent is gone and the breadwinner is gone? So there are many issues, and that we are trying to work through. There are a lot of laws, legal, child protection laws, which are there for a reason, which have to be respected, and things like that we have to work through as we go about doing this. So we, like I said, our measures are going to be, we're going to identify genuine beneficiaries. It's a cumbersome task, but a very important task. So we have to identify the beneficiaries. There are things that the government is doing, so we make sure that we don't do those things. We don't duplicate, right? But there will be things that the government is not doing, or it's out of their area of coverage. So we will look at those. We will need to have a campaign for getting children back to school. So again, we're talking about underprivileged communities where, not going to school for a year and a half, just going back might not be a priority for them. So we'll try and do that. We'll have to train, the widows, or skill training. That will have to be looked at. And along with skill training, self-development too, because that's a very important part. Self-development, skill training, health and nutrition awareness, and even like funding kitchen gardens. And we have done that. Seva Canada has done those projects. So we would have to leverage all of that. So that's our future work, the oxygen plants and the social economic impacts, addressing those, and the work in improving the medical infrastructure. So that's the midterm, current, and future work. Now, the numbers, the money. So the fundraising status, so we raised $716,000 over GoFundMe, Facebook, Canada Helps, and checks, and with help from a lot of you donors and partners. And just for transparency, I will open up the books, and I just wanted to show you what how it totaled up. And this is the workbook that we work off, and you can see all the numbers here. You can see all the partners here listed. Some of the partners may find their names in there. So this is what we have raised. Okay, and many of you can you find your organization names in here. So we raised this amount. So and what about the spending? So 716, that's fine. So how are we spending it, right? So let's go back here. So this is our budget, and this is something that we spend a lot of time over planning, and what needs to be done and what has been done. So in the white that you see is all that we have spent. So we have spent $382,000 of the $716,000 that we have raised. It went towards oxygen concentrators, accessories, medical equipment, and ward expansions that we have already done. So what is in yellow is stuff that we have not done yet. So there's COVID care center support costs for running the COVID care centers in some provinces, medicines, vaccines, cremation costs, oxygen plant costs, and then the social development programs. So this is what it is. And I can go into the details and I can just show you what we work out of and how that works. So this is a budget sheet that we spend a lot of time on. And basically it's got the state-wise, what we're doing in each state. So this kind of is a dashboard for us, tells us what we want to do, and any new requirements come in, we put that in here. And this is what we have spent so far, like I showed earlier. This is what is we raised totally. And we have $150,000 set up for the social development programs, and the balance is zero. So just a highlight, Seva Canada has transferred 100% of your donations, or will transfer it to India. Every one of us has a day job. We are all volunteers, right? So as you can notice, there is not a line item for salaries or things like that, support costs, right? So, and if you go to the CRA website, it reflects our overheads are 4%, right? And we try very hard to keep it that way. And I think in this campaign, like I was telling somebody, our only overheads were the GoFundMe charges that they kind of took, the commissions. So that's the forecast, the fundraising status, and the budget, what that we have spent and that we're going to spend. If you have any questions, by all means, please keep it for the end, and we'd be happy to answer all of this. But from a donor relationship perspective, we just wanted to be totally transparent to what we're doing. So on June 1st, we had a slightly different number on how we were spending our budget, but with things being so fluid on the ground, with the social impact, the scale of the social impact coming to picture now, we are realizing that that's a big issue now. And oxygen plants, the government of India is building a lot of oxygen plants. Many of the NGOs are building hundreds of oxygen plants. So we are doing 2. So we kind of cut back from 3, we went back to 2 and put that 50,000 into the social economic impacts bucket. So that's what you're seeing now, 50, 15, 15, and 20. So that's the split that currently from the donations that we have got is that we're going to do. In addition to that, we have 2 partners. In addition to this project, what are we doing in addition to this project? We have Oxygen Langa, which is an organization by a group of young professionals, presidents of or entrepreneurs in Canada. They have put down a program, and they have funded about 108 concentrators, and we're actually deploying them now. Though the use is low, we're preparing the rural health centers and hospitals for the next wave. So we are already doing that. We have already deployed about 30 of them. 40 are en route to Manipur, and we are still to deploy 36. So that's happening. And while that is happening, we have Trillium Health Partners, which is the biggest hospital system in Canada. They are partnering with us in building oxygen plants in Rajasthan, in Assam, and many other places. They are putting in oxygen plants. They raised about $600,000, the Trillium Health Partners Foundation, and they're channeling it to India, and they've selected Seva Canada to work with them, and Seva International in India to work with them in implementing this. And they're not only putting this, so they're putting medical equipment, most of these oxygen plants, but then oxygen plants in some places also need generators, electricity, because in rural areas, electricity is a problem. So they're doing that as well. So these are 2 things that are ongoing as we work on the money that we have raised. We are also working with on these 2 projects. Now, apart from all of this, what are we doing? We are working in Nepal. Our brothers and sisters in Nepal, just across the border, they were hit very badly too. So we've been working in Nepal, and it's kind of peaked there. It's kind of, we're seeing the downturn right now, but we're also working in Nepal. And we provided about $60,000 worth of aid. It's about 50 concentrators. We may need some more, but there's a lot of food relief required. People are hurting. They depend totally on tourism, and that's been hurting for the last year and a half. The medical infrastructure is weak. So we have an opportunity here to strengthen the medical infrastructure in Nepal. So again, we're going to replicate to a great extent what we've done in India with some oxygen plants. We're going to do some medical equipment. We already started providing medical equipment to some hospitals, and our team there, Youth for Seva Nepal, has been just amazing. These boys, again, have been fearless on the road 24/7 for the last 3.5 weeks. And sometimes I have to call them and say, stop driving at night. Because if any one of you have been to Nepal, you know how dangerous the roads are. On one side, you have a steep fall and it's a narrow road. And then you have two vehicles crossing each other, right? So I told them standing orders, no more work in the night. Don't drive in the night, right? They are our biggest assets. And without them, all the donations we collect here, all the work we want to do wouldn't happen. So this is what we've been up to. And again, Pranam, and thank you for your support, generosity, and the donations. Namaste.
Okay, thank you so much, Manoj, for that wonderful presentation on what's going on in India right now. Next, we will have some testimonials from some of our partners. And these partners have fundraised with us with their respective organizations, and they'll be sharing their experiences fundraising with Seva Canada. So we'll begin with Dr. Sumitali Sundararajan from Calgary. If you're here, please unmute yourself and tell us your experience.
Hi, Vinod, and I know only Vinod in this entire team. Thank you so much for giving me this opportunity. But before I talk, I have asked Aravind from Karaikudi to join us as well, and he's online as well. I think he has to leave to his duty as soon as possible. Maybe we should give the opportunity first for him to talk first before he leaves.
Yeah,
is that
yeah,
okay?
Fine. Yes, that's fine. And
yeah, because I think
yes.
he has to leave to the duty in another 10 or 15 minutes. That's what he was saying. So I thought maybe we should give an opportunity for him to talk, because he was the one who their hospital was the one which directly benefited from you. Really, he's so much impressed with it. So I think probably his testimony will be more helpful than a mediator.
Yeah. So just for the benefit of everyone, Dr. Arvind Kumar is the doctor at the Karaikudi Government Hospital in Tamil Nadu, and over to him, Dr. Arvind.
Yeah, I'm Dr. Arvind from District Headquarters Hospital, Karaikudi. Sir, we are very much grateful to you. The first is the second wave of pandemic. First, it starts. We are in utmost need of everything: the mask, the sanitizer, even oxygen, the basic need of the human being. Everything we need. The first, you show the hands towards us. The 7 oxygen concentrator we have received is so much of helpful to us. Even the first wave, we can't see this the death tragedy this much. The second wave, we lost so much of human lives. But at the time, this Seva Canada and the representatives here of Seva Canada, they lend their helping hands towards us. They provide NRB mask and oxygen concentrator, everything. We are very, very, very grateful to you, sir. And they also provide helping hands for oxygen plant also. But the local entrepreneur will help us to build an oxygen plant. So we are very thankful to you. Thank you very much. But the third, you tell about your budget allocation, about the social. Now we are, sir, can I talk some more time?
You go ahead, Dr. Arvind.
Yeah, thank you for giving me the time. The third, the 20%, the social awareness and social thing among we are standing on the 2 legs. That's one for our life and another one for livelihood. So we have to go out for our bread and butter. So everyone goes out once the lockdown gets to slowly get diluted. Everyone goes out and they get easily captured the disease. This is the major problem that we have to eradicate. Now we got, because of you people, we got very good medical equipments, oxygen plant, oxygen concentrator, everything. But the social awareness is also must. So that we have to allocate for that also, sir. Thank you.
Thank you, Dr. Arvind. And I can add, when our volunteers on the ground went and delivered these concentrators, the chief medical officer of this hospital said, people gave us food, but we never thought there would be a day when we would be asking for oxygen. And Dr. Sumatali was the main reason that we got this contact. She called us from Calgary, and within a week, we were able to turn it around and get them these concentrators. So thank you, Dr. Sumatali, for your inspiring effort. And I know after that, you didn't stop there. You did a lot more work, which I'm sure you won't talk about, but I just want to let everybody know.
Thank you, Sumatili. I vow to you very much. Thank you. Thank you, Vinod sir.
Thank you. Dr. Sumatali, do you want to share something? Anything more? You want to add anything more?
So I'm Dr. Sumatali. I'm one of the family physician from Calgary. I'm originally from Tamil Nadu, and I'm right now practicing in Calgary. So we wanted to do something for India. We didn't know where to start and how to start. My daughter wanted to do some fundraising. So I was just, I came across Saravanan from Calgary because I know he does a lot of fundraising. So through Saravanan, I came in contact with this lovely person, Vinod. Really, I should thank Saravanan first for that, for introducing me to Vinod. So the first time I just asked him, we want to do something for India. We are trying to organize some fundraising. My daughter really wants to do this, but we didn't know the proper channel, how to do this. And then he was asking what's the first thing that you want to do? Well, I came to know from a classmate, he's an anesthetist in Karaikudi GH. I came to know they don't have a single drop of oxygen there. And a lot of people are dying without oxygen. So we wanted to ship oxygen concentrators to them, but we are going to start the fundraising only now. So I don't know where to buy, how to buy and everything. So within another couple of days, I got a message from Vinod saying that we are going to organize this through Seva Canada. And I know you will be starting this fundraising, but probably it will take a long time for you. They do really need the oxygen right now. So we are going to organize that through Seva Canada. So he took the initiative, and within another one day, I think within one or a couple of days, I heard back from my friend. He was so excited. He said, somebody from Seva Canada in India contacted me and said that they are going to bring us around 10 oxygen concentrators. They are going to ship within another couple of days. And he was like literally in tears, thanking me to organize this. And I said, it's all the credit goes to Seva Canada. It's nothing that I did. I just told him that we wanted to do, and he just right away pushed everything in the front. So I really thank you so much, Vinod, for doing this. This is something, it was a good eye-opener, and it was really motivating for my daughter also to start this fundraising. We did do that, she was able to collect some fund, and we were doing some things to the government hospitals in Tamil Nadu. But whatever you guys are doing is so much impressive and motivating for all this younger generation, I think. I was even asking my daughter to join today, but she was doing so. She was in the beginning, but now she just quickly went somewhere. She had some phone call, I think. But anyway, thank you so much, Vinod. I really appreciate all the efforts that you have done for Karaikudi GH. And I heard from my friend that you were initiating even for the oxygen plant. He was so much impressed, and we are all so much impressed. Thank you so much.
Great. So next we'll hear from Dia Sen from Jumle Dance in Montreal.
Hi, everybody. Can everybody hear me?
Yes, we can.
Awesome. Amazing. Hello, everybody. Thank you so much. First of all, Vinod, so nice to see you finally here. And thank you for everybody who's joining this webinar today. Some amazing work and updates. So super impressive. I am the founder of Jumle Bollywood Dance Fitness. I'm from Montreal, Canada. So when the second wave hit India, it was affecting millions of people there, right? Including my family, my extended family members, my friends. So it became a very personal and a very emotional cause for me. I wanted to help. I wanted to, see what's the best way to get there. And I knew I had one power with me, which is the strength of my Jumle community, my Jumle family. over 2,000 people. What can we do together to come together and help India at that moment? So I was talking to one of my Zoomers then, her name is Melanie, and we started to talk, and we wanted to do a fundraiser as a community. We really wanted to channel it, in partnership with an organization who is doing the right kind of work, and who really knows how to get the work done in ground, okay? So I got in touch with Seva Canada, and I think within 24 hours, Vinod responded to me, and it was impressive. It was impressive to see the kind of work that they were doing at that time. This is like, what, 2 months ago or something like that. And they were already on the way of raising 250K or more at that time, getting all the immediate COVID relief supplies, oxygen concentrators. So that was very fascinating for us. So he really helped us kind of gave us guidance on how to set up this fundraiser, and I was amazed on how easy it was to set up this whole through GoFundMe. So that was a very easy process, and we reached out to the entire German community, and within 5 days, the amount of outpour support, generous donations that we got from everybody, that was really heartwarming. We almost had to change our donation goals like 4 or 5 times. We were surprised to the amount we reached. And my commitment was that to every donation that was given, I was going to match it. So almost double each donation amount. And together as a community, we were able to raise over 7K. It also almost trickled down to other Zoomers in the community who got really inspired, who then started, having their own parallel fundraisers through Seva Canada with their colleagues, with their workforces to raise more money. So that was the fundraiser part of it. Then within a few weeks, I think 3 or 4 weeks after that, Vinod reached out to me again. And he told me that, they were going to dedicate our donation amount. They were going to match our donation amount with the efforts that was happening in Gujarat, in a specific part of Gujarat called Dharampur and Koba. So that's when Vinod got me in touch with Paresh, and he was kind of bridging the gap between Seva Canada and the local organization on ground called Lokmangalam Charitable Trust. And the person heading that trust, Neelam Bai, again, if you are here or if you see this post live, a huge thank you for all the incredible work you're doing. Very, very inspiring. I was just blown away. I was blown away with the transparency that was provided to me. I was provided with an Excel sheet of the breakdown of each, the donation money and where each cent is going. I mean, who else does that, So when I heard that with our donation money of 7K or more, we were able to get 5 oxygen concentrators, 30 infrared body thermometers, 30 oximeters, 100 oxygen masks, 1,000, face masks, and food and medical relief supplies. Like you don't have any other words to kind of express your feeling at that moment. And to put the cherry on top of the cake, okay, here's the moment. We see volunteers in action and their images, okay? We get images from Seva Canada, pictures from Seva Canada. Our volunteers, I think you guys call them the Seva warriors, on ground, and seeing that, your donation in action. When I shared that with my community, just a week ago, we were blown away. There are tears in our eyes, heart filled with gratitude, and honestly, super, super inspiring. So really thanks to Vinod, Paresh, Lokmangalam Trust peeps, all the local volunteers, the Seva warriors, really at this moment of need to kind of, come from a space which is Canada right here to kind of see how this whole thing pans out at a ground level. I mean, if this is not going to inspire the youth, people like me, I don't know if what else will. So thank you, yeah.
Thank you so much, Diya ji. Next, we'll hear from Nanda Kumar ji from Canada Kannadigas, and he is based in Kitchener.
Namaste, everybody. Good evening. Hope you all can hear me.
Yes, we can hear you.
Okay, thanks. I'm Nandakumar Chodappa. I represent Canadian Kannadigas, and I'm here with my team, Dr. Arun Prakash, Dr. Osarli Ramswamy, Venki, Karthik Gowda, Amulya, and Krishna Prasad Balike. They're all joining us here. First of all, we wanted to tell a huge thanks to Seva Canada for making this happen. We were able to mobilize funds from Canadian Kannadigas and send it across to some of the hospitals in Karnataka, all over Karnataka. And this was possible only because Vinodji actually helped us. He guided us. He was our mentor throughout this whole exercise. So I just want to run through a presentation regarding what we did. Our campaign was named as Usiradali Karnataka. That means let Karnataka breathe, because there was a shortage of oxygen concentrators or ICUs and ventilators. So all we could do was send some concentrators from here. So at the time when we started this campaign, there were like almost 450,000 cases every day in India. And particularly in Karnataka, almost 10% of that cases were from Karnataka. Most of the news that we used to get were from our family and relatives and friends from Karnataka, and we used to hear everything from there. It was very devastating. Within a matter of 2 days, we all got together. We are different Kannada organizations from all across Canada: Toronto, Ottawa, Montreal, Halifax, Vancouver, Edmonton, Calgary, Regina, KW area, and London. And we collected about $41,000 in about 2 days, 48 hours. As a matter of fact, we were able to, Vinodji actually helped us to structure this very well. He said he gave us donation links, how to send it to Seva Canada, and how Seva Canada will all channelize our efforts back home. And with help of Vinodji, we were able to procure these 25 oxygen concentrators. It was all transparent to us. Like, we were just talking to Vinodji, and he was just making that happen like in a matter of few hours. And we used to get news from him that everything is arranged. These were the links that we were using for doing this. And all our concentrators went to all interior Karnataka, like the taluk centers: Karkala, Udupi, Gadag, Belgaum, Dharwad, South Canada, Molkalmuru, Davanagere, Karwar, Tiptur, Bangalore, Kodagu, Chamarajanagar, Jamkhandi. These are all rural areas where there are hardly any hospitals, and they were finding a lack of all these oxygen equipments there. And it was very helpful at the time. And one thing is that with the help of Seva Canada, we were able to procure and send it at the right time, and it helped save a lot of lives. These were the concentrators that reached. There are some of the pictures that we got from the ground team. Since we collaborated with Mr. Simant Kumar Singh, who is the ADGP of Karnataka, is the police commissioner. He helped us to gather all the volunteers, and he was able to distribute all these things. Since it was through police network, though there was a lockdown, we were able to convey these concentrators right away to all the hospitals that needed them. These are all some of the very rural areas that it went to. And the structure that we formed was all the Canadian Kannada organizations. We were able to send funds through Seva Canada, which sent the oxygen concentrators to BGIF, which had ATG registration back in India, in Karnataka. And these people coordinated with Group O2. These are a group of volunteers, about 2,500 volunteers back in Karnataka, who networked from all over taluk centers, and these are working directly with the patients, COVID affected patients. And they give us feedback regularly. based on the usage and what devices have been used so far. From Seva Canada, of course, we have to thank Vinod Varapravanji. He was with us all the time. Not only that, he also helped us to understand the whole structure, how we have to do this, how in a matter of emergency, how we have to structure a campaign like this. We learned a lot from him. Even under that pressure, he was very calm. He was directing us. We used to call him day and night. He never flinched. He gave us all the information whenever we asked. And from our team, there was Shruti Kirti, who had worked for Seva India, and she's here. So she joined hands with us to get to channel this whole campaign. And we had Sachin Bhatji also helping us with documentation and stuff. In Karnataka, back in Karnataka, Mr. Simant Kumar Singh, who is the ADGP of Karnataka, and Dr. Kishore Bhattar, who is working for the IRS of in Karnataka, Mrs. Deeptika, Kamal Kedia, Subhash Kedia. These were the people who were helping us on the ground. Here, this is the Kannadiga panel. This about 25 people who joined hands here to make decisions about how to mobilize these funds and send it across. And with the help of Vinodji, we were able to do this. Thanks a lot for listening, and thanks a lot Vinodji, and thanks a lot Seva Canada for helping us do this. It was the right thing to do at this point of time, and thanks for showing us the right way. Thank you.
Thank you so much for that presentation. And finally, we'll hear from Dilip Shekhawat-ji from Rising Runners in Winnipeg.
Hi everyone, Namaste. I'm Dilip Shekhawat. Happy Father's Day, first of all, to everyone. I'm Dilip Shekhawat from Winnipeg, Manitoba. I'm the founder of local running group with 72 active members from South Asian community. So why we started this group last year? Because it was pandemic and people wanted to do something. They were all home stuck. So we started this running group where we can go out and do our group runs. And we also now become a bigger group. So we started doing community service, such as trail cleanup, delivering meals to homeless people. And then we started looking new avenues to support charities for fundraiser. So I will share my first-hand experience. In April, I traveled to India because my father was not doing well. He was admitted in the hospital. And as I reached there, things started getting worse. And around mid-April, I lost my uncle, my cousin, because of this second wave of COVID. It was heartbreaking to see the scenarios in the hospital when I was moving them around, and my sister got COVID, my brother-in-law was like, it was like very chaotic environment when I stayed there. So, I thought that this is the time to act. So what we can do, we have a bigger group in Winnipeg, and we all, have families in India. So I talked to our core committee members where we came up with this idea to raise funds. So I was looking for organization where we can donate. So I contacted AIMS Hospital. I contacted Shri Gangaram Hospital, but I didn't get any concrete reply from anybody because people were in chaos everywhere. I realized that this is not the time. So, and then I found Seva Canada through Google, and I contacted Mr. Vinod that, this is what we are looking for. And on 27th of April, we swung into action and we collaborated with Seva Canada and we organized this fundraiser. So we did two, one on Facebook and other was, because we are running groups, so we organized a Breathe India run. And 166 people donated to that cause. And we successfully raised 11,000, a little over $300. It gave us great sense of pride and honor to feel connected with India. And it made us feel like part of something bigger than ourselves. So I really thank to Seva Canada for giving us this wonderful opportunity to raise funds and the work they're doing for Indian communities. So great work to Seva Canada, and thank you to Mr. Vinodji for guiding me wherever I needed help. So thank you.
Thank you. Thank you to all our partners who gave testimonials today. We really appreciate it.
you.